issues, assuring that women's health care concerns, which are different from men's in many instances, are a part of any health care coverage in our country, and ongoing we must assure the same. I have been an advocate for cancer screening services for women, and I was dismayed when I saw the United States Preventive Services Task Force a few weeks ago issuing new guidelines for cancer screening for women, breast cancer screening for women. We all know that we have lived with breast cancer throughout, of course, the history of women, but especially in the last probably 25 years, the strides that we have made in saving and survivability of women with breast cancer is because we have early detection. We don't have a cure for breast cancer. We're all fighting for that cure. But until we get it, the first line of defense is early detection. So now we have a new task force recommendation that says everything that we have had and enjoyed over the last 25 years, saving women's lives, is no longer relevant, because now, before the age of 50, you don't really need a mammogram. And after the age of 50, it's every other year. Well, I know Senator Murkowski and I agree that we don't think that's right. Neither did any other woman in the Senate when that was proposed years ago by President Clinton. We all stood up and said no. And I'm standing up and I'm saying no again, and I'm sure every woman in the Senate is, as many women in America are. But the Murkowski Amendment doesn't actually fully address the problem of having the task force, which is relied on 14 times in the bill before us, as the arbiter of what is necessary for our government program, and then will surely become the private sector standard as well. And that task force even has money allocated to advertise its task force recommendations. So rather than the Murkowski Amendment severing the ties with the task force, the amendment now has another government agency that has the same capability to basically interfere between the woman and her doctor, which is where we want the decisions to be made. Coverage decisions will be dictated by both the task force and a new Health Resources and Services Administration entry into the mix. While I certainly agree with Senator Murkowski about the importance of preventive services for women and insurance coverage decisions, I just can't support her amendment because we still have not one but two government task forces and committees that will be in the middle of these health care coverage decisions. I think the coverage decisions should be made by doctors and their patients. That's why I've joined with Senator Murkowski in offering the alternative approach. This is what we should expect from any future health care reform. It is certainly what we expect today. The Murkowski Amendment will leave the medical decisions to the guidelines established by those who know medical treatment best, which is our own doctors. In fact, we have just received a CBO assessment of what the Murkowski Amendment would cost, and it actually says there will be a savings. So rather than the Murkowski Amendment, which would spend $1 billion over 10 years, the Murkowski Amendment would actually save $1.4 billion over 10 years. Why? Because the Murkowski Amendment relies on the combined common sense and clinical judgment of American physicians.
Senator's time has expired.
So, Madam President, I urge a vote for the Murkowski Amendment, and I know we have the same goals as Senator Murkowski and her amendment, but I don't believe the Murkowski Amendment achieves the goal of having a woman and her doctor make the decisions for her. That's the key that I think is so important in this debate. I urge a vote for the Murkowski Amendment. Thank you, Madam President, and I yield the floor.
Who yields time?
Madam President, I yield 4 minutes to the gentlelady from the state of Washington, who's been a real leader on these